Criminal charges filed against 324 individuals in various healthcare fraud schemes, involving over $14.60 billion in alleged fraud. Washington, D.C., Urdu News. The U.S. Department of Justice has announced the largest ever nationwide healthcare fraud enforcement action in American history, resulting in criminal charges against 324 individuals involved in various healthcare fraud schemes totaling over $14.6 billion in alleged fraud. Among those charged are 96 licensed medical professionals, including doctors, nurse practitioners, and pharmacists. The operation was conducted across 50 federal districts and involved the offices of 12 state attorneys general, with participation from both federal and state law enforcement agencies. According to the Department of Justice, more than $245 million in cash, luxury vehicles, cryptocurrency, and other assets were seized during this historic operation. To prevent abuse of healthcare programs, the Centers for Medicare and Medicaid Services, CMS, withheld an additional $4 billion in payments and suspended or revoked billing privileges of 205 healthcare providers. Several international criminal organizations were also charged during the operation. These groups are accused of defrauding health insurance programs of over $12 billion. In one case, a suspect from Pakistan and the United Arab Emirates was charged with defrauding Arizona Medicaid of $650 million through fake substance abuse treatment programs. Similarly, in northern Illinois, 2 individuals of Pakistani origin were accused of being involved in a $703 million fraud case where artificial intelligence was used to generate fake calls, obtain patient information, and submit fraudulent claims. The charges include schemes involving $1.1 billion in unnecessary wound care treatments, illegal distribution of 15 million opioid pills, $1.17 billion in telemedicine and genetic testing fraud, and other scams involving over 170 individuals. U.S. Attorney General Pamela Bundy stated, "This record-breaking action brings to justice those criminals who exploit our innocent citizens and taxpayers." Secretary of Health and Human Services Robert F. Kennedy Jr. said, "We are on a mission to make healthcare accessible and affordable for the public, and strong actions against healthcare fraud will continue." The agencies involved in this historic operation include the FBI, the CMS, IRS, USPS, HS, OIG, and various state and local agencies. The goal of this action is not only to punish criminals, but also to restore transparency and trust in the healthcare system. For more information and details, the full report is available on the Department of Justice's official website.